In the Philippines, nursing is a passport out of poverty.
300,000 sa kanila, walang permanenteng trabaho
Meron
sa
ka ng lisensya, pero hindi ka tinatanggap sa mga ospital.
Nagtatrabaho na, pinagbabayad pa.
Getting into debt for a career they thought would provide a good and stable income.
Representative Leah Packers is recognized. You may take the floor.
Mr. Speaker, I stand here today to talk about healthcare and the majority of the health workforce called nurses. Allow me now to focus on the nursing workforce, the care specialists, the silent heroes of the healthcare system. Where are the nurses?
Did you know? Kung bibilangin ng registered health practitioners sa Pilipinas, nurses are among the largest group even though there are very few nursing positions or jobs available to them. Only 15 to 25% of jobs in the Philippines are provided for the nursing population. Every year, the national government has approximately 18,000 nursing positions with an eventual turnover of 1,000 careers.
For the longest time, nurses are oppressed and neglected. Pero ngayon ay unti-unti na itong nabibigyang pansin dahil may boses na ito sa Kongreso. In the opening of the 16th Congress, ang NARS party list who represents the nurses and the health workers filed House Bill 151 entitled Comprehensive Nursing Law. Ito ay para tugunan ng iba't ibang problema ng mga Filipino nurses. Sa ospital nga lang ba ang scope of nursing practice? Paano naman ang mga nurses sa academe? Sa larangan ng research. In House Bill 151, ito ay binigyang linaw. The scope of nursing practice is divided into 4 categories. In 2005, nag-boom ang nursing sa Pilipinas. Maraming eskwelahan ang nagsulputan para mag-offer ng kursong BSN. Maraming gumagraduate pero kakaunti lang ang pumapasa. Hangad ng ang NARS na magkaroon ng National Nursing Admission Test as a pre-qualifying condition to the admission to the BSN program. The bill also formulates an advanced practice nursing program to upgrade the level of skill and competence of specialty nurse clinicians. Sabi nila, there are only few job opportunities for nurses in the Philippines. Kaya naman nilalayo ng HB 151 na mag-generate ng employment for nurses through adequate health human resource by providing for a nursing personnel system with permanent positions for nurses to be employed in communities, school, workplaces, establishment, hospitals, and other health facilities. Kung saan ang mga ospital na mayroong 10 nurse ay magkakaroon ng nursing service office under the control and management of a chief nursing officer. As an advocate for decent pay, decent work, House Bill 151 requires the nationwide implementation of Salary Grade 15 as the minimum base pay of nurses, both in the government and private institutions. Also, the bill mandates that health institutions to follow the ideal nurse-patient ratio of 1 nurse per maximum of 12 patients in general ward. Sa kagustuhan ng ANGNARS na maipatupad ng tama ang probisyong nakasaad sa House Bill 151, it increased the penalty for violators that may even result to suspension or revocation of license to operate a health facility. Habang nakabinbin pa sa Kongreso ang House Bill 151, nais ng ANGNARS na maipatupad ng tama ang umiiral na batas and filed House Resolution 1786, directing the House Committee on Civil Service and Professional Regulation to conduct an inquiry, evaluation, and assessment in the exercise of its oversight function in the implementation of Republic Act 9173, also known as the Philippine Nursing Act of 2002. ANGNARS is constantly pushing for the concerned agencies to fill up the existing plantilla positions for nurses and comply with the nurse-patient ratio in general ward pursuant to the DOH hospital staffing standards. Hindi pa rito tumigil sa pakikipaglaban ng ANGNARS. On January 8, 2015, ANGNARS together with the Public Service Labor Independent Confederation and other organization filed a petition for certiorari and mandamus before the Supreme Court to settle the legal issues that hamper the implementation of Salary Grade 15 for nurses, as stipulated in the Philippine Nursing Act of 2002. Sa tindi ng kompetisyon sa mga ospital, isa ka ba sa naging suki ng seminars, workshops at training programs? Isa ka ba sa mga namulubi para mag-training upang mongolekta ng lisensya at certificates? Isa ka ba sa mga nagbayad para mag-volunteer upang magkaroon ng experience? Experience which are not even recognized by employers because it doesn't equate to employment experience. At upang maiwasan ng mga biktima ng ganitong iskema ng false trainings, ANGNARS initiated the crafting of the guidelines and regulations for in-service training programs with the Professional Regulatory Board of Nursing and the Department of Health. to require the employers to shoulder the cost of the training programs of their nurses. Ang NARS also collaborated the regulation of volunteer programs with the Philippine National Volunteer Service Coordinating Agency and the DOH to stop false volunteerism of nurses in the country. Bukod sa false trainings and false volunteerisms, naganap din ng precarious work arrangement ng nurses, gaya ng job orders and contracts of service kung saan hindi tama ang sweldong kanilang tinatanggap, no statutory benefits and no security of tenure. Dahil dito, ang NARS strongly endorse Katipo NARS PS Link, a strong, accountable, comprehensive, responsive, effective, and democratic national union of nurses that engage in collective negotiation for fair and equitable terms and conditions of employment. Aktibo rin ang NARS sa budget hearings, deliberations, and debate for the General Appropriations Act to transform RN Hill's program to Nurses Deployment Program, transition gradually the Nurse Deployment Program from job orders to casual to permanent employment, to fill up the unfilled funded plantilla positions in the DOH and its retained hospitals, and to fully implement the Magna Carta for public health workers. It also opposed the rationalization plan of school nurses in the Department of Education, kung saan inalisan ng mga plantilla positions ang mga nurses sa kadahilanan na sila ay non-teaching health personnel. Karapatan, kalusugan, kabuhayan. Ito ang sigaw ng NARS para sa mga nurses. Kaya naman pinulong nito ang mga leaders ng different nursing specialty organizations kasama ang PhilHealth at Department of Health for the inclusion of the nursing service in the PhilHealth packages. Ang NARS initiated and became instrumental in the revision of Annex C of DOH Administrative Order 2012-0012, which now recognizes the nurses as one of the healthcare providers who can handle actual normal deliveries and own, manage, and operate a birthing facility. All of this and more before the first term of Ang NARS party list ends. Nurses are not just health workers. For Ang NARS, nurses are the care specialists, the silent heroes of the healthcare system. Serbisyong hatid ay walang kapantay, saan man sa mundo sila ay nangangalaga ng buhay. Tamang trabaho, tamang sweldo, tamang solusyon. Ang NARS, naninindigan para sa kalusugan ng bayan.